And I am so excited today to be able to introduce you to the panel that we lined up. As you know, this topic is on the forefront of all of our minds in terms of how do we get all these different resources to work together in an integrated fashion so that we make the experience as streamlined and least burdensome for the households applying for assistance as possible. This program, as we know, all began out of the pandemic and the huge increase that we're seeing in need and past due bills and disconnections of services. And so getting this program up and running, but in a coordinated fashion, is so, so important to all of us trying to implement it at the state, local, and federal level, but also for the households that are trying to figure their way out through the system. So as you know, the Division of Energy Assistance oversees the Low-Income Home Energy Assistance Program, LIHEAP, and as well now oversees the Low-Income Household Water Assistance Program, LIHWAP, and that is not a coincidence. The directions in the legislation from Congress were really for HHS to try to use as many of the existing processes and procedures as we could in order to start up the LIHWAP as efficiently and effectively as possible. And so we chose the LIHEAP as our role model for the LIHWAP. And as many of you know, LIHEAP has a 40-plus year success record of working at the state level, the tribal level, the territory level, as well as at the local administering level with all the community action agencies and the other nonprofits and local governments that are all a critical part to this intake process and getting households assisted. And so today we are very excited to talk about how you can integrate with the Community Services Block Grant Program, which is also administered by many of those same local intake agencies. And so there's great partnership opportunities across the board. And later this week, you'll hear about other partnership opportunities. So with that, I would like to take care of a few housekeeping remarks, just so everyone's on the same page. First, I'd like to mention that, of course, today's webinar is being recorded. We will be posting online the closed captioning file as soon as that part of it is complete, but we will also post the PowerPoint slides to our OCS World Water Week website this afternoon. We will also add a link about that website to our chat box. After our speakers have finished their presentations, we will have a moderated Q&A session. So I encourage you to ask questions in the Q&A box, which you'll find in the bottom center of your screen. Not the chat box, but the Q&A box. And so that is where you can post your questions and feedback. You can really save the chat box for general comments or greetings, or if you're having any sort of technical problems hearing or seeing the presentation today. Lastly, towards the end of the presentation, we will add a link to the chat box so that you can evaluate today's session. I ask that you please take just a moment to fill out that 6-question survey so that we can better serve you in the future. And as you heard yesterday, on the first webinar of this week, we are just so excited to be learning along with all of you about this exciting program and the water and wastewater field and network, and really be sharing in this learning opportunity. So thank you again for joining us this week. So now I'd like to move to the next slide to remind you who we're going to be hearing about from today. So our moderator, who will kick off the Q&A session later on, is Miranda Lynch-Smith, who is the Deputy Assistant Secretary for Planning and Evaluation at the Department of Health and Human Services. And she has been a great partner to us and helping us understand a little more about how we can reach households that have been particularly impacted during the pandemic and may be newly eligible for these kinds of programs because of the pandemic. Before we get to Miranda, our main speakers include Seth Hassett, who many of you know from the Office of Community Services, Sharice Johnson, also from our Office of Community Services, and two of our key partners at the local level with Wayne Metro Community Action Agency, Lewis and Mia. We so appreciate their partnership. We have been in conversations with them basically since the beginning of this program, since January. And I do want to give a shout out to Denise Harlow, the Executive Director at the National Community Action Partnership, NCAP, who put us in touch with Lewis and Mia. And really just, we appreciate so much that NCAP and that their their network, their local agencies have really been sharing the learning with us all along so that we could understand what success models already exist out there at the local level so that we can share that with the rest of you. So without further ado, let me turn it over to Seth, our first speaker. Seth?
So, good afternoon. I'm Seth Hassett, a senior advisor in the Office of Community Services. And as some of you know, I served for 12 years as the director of the Division of Community Assistance in OCS, which is the division that manages the Community Services Block Grant, or CSBG. And that's the position that's now held by my colleague, Cherise Johnson, who will be next in this presentation. More recently, I've been advising and assisting in a variety of special projects, including working as part of the team to help stand up this new LIHWAP effort. Next slide, please. So I'm going to be providing some background today about the status of the LIHWAP effort, and then Cherise Johnson and I will be sharing some guidance about and information about ways that both the Community Services Block Grant and LIHWAP funds can be used in a collaborative effort that helps each program area accomplish its mission and can help lead to better and more coordinated services, not only to help households meet basic needs like water and other utility support, but also to coordinate with a range of other services available through community action agencies that receive CSBG. And we're then going to hear, as you heard from one of the pioneering agencies in this area, Wing Metro Community Action. Next slide, please. So let's begin with some background on this low-income household water assistance program effort. Next slide. So LIHWAP effort was funded as the result of two emergency appropriations. Congress appropriated $638 million in the Consolidated Appropriations Act and an additional $500 million in the American Rescue Plan. The legislative instructions were essentially a couple of paragraphs of text. That's not unusual for supplemental appropriations, but what is unusual is that this is an entirely new effort. The legislation outlined criteria for a formula to allocate funds to states and tribes. It indicated that funds were to be used to assist low-income households with high water burdens to pay arrearages and to reduce current rates for drinking water and wastewater services. And the legislation indicated that this was to be done through payments to public water systems. And it indicated, as Lauren indicated, that HHS should use, where possible, existing processes and procedures for comparable programs. There is no permanent authorization for LIHWAP, and this is considered to be an emergency effort. So next slide, please. So while there are a number of reasons that we believe this water effort was considered to be part of a larger governmental effort related to COVID-19. The first is that the household water access is really critical for households to meet basic sanitary needs, to maintain social distancing in the midst of an ongoing threat of a contagious virus. And many states have instituted moratoria on shutoffs to help households maintain basic water services during the crisis. But this means that some households have been unable to pay, have accumulated large debts. And as moratoria expire, many households are faced with not only these large debts, potential disconnections, and the water utilities themselves face financial risks as they work to maintain community services. Next slide, please. So based on our legislative instructions, OCS set 3 priority areas related to this new LIHWAP effort. The first is to restore services for households that have already been disconnected due to arrearages. As indicated in guidance and instructions provided by OCS, grantees may pay the full amount required to restore services. This could include standard reconnection fees and charges, as long as these aren't special fees charged just to LIHWAP recipients. A second priority is to to prevent disconnection for households that are at immediate risk of losing services due to arrearages. And just to say, these 2 areas are top priorities for this emergency effort. As one of our speakers shared yesterday, that a household without running water or drinking water can become virtually uninhabitable. And if you've ever had water due to a storm or inability to pay, you know it may not take long before you're not able to perform basic functions. So some grantees have indicated that past due debts are so significant that addressing needs for these two priorities may take up all or most of the available resources. Next slide. The next priority, consistent with legislative concerns, is reducing rates charged to low-income households where possible to help ensure affordable household water. And as I noted, some grantees have indicated they may not have resources to fully address this priority. In some cases, these states and other grantees should, at minimum, continue to assess unmet water availability needs and available resources. For households with current bills still seeking assistance, a benefit matrix should be applied for this category to ensure equitable distribution of resources based on need rather than a flat rate. And consistent with the legislation, grantees will need to consider the household water burden, meaning the percentage of a household's income devoted to water bills in creating a benefit structure. While many grantees do have experience with similar work in the low-income home energy assistance programs, or LIHEAP, we know this is not easy work and takes significant learning in terms of the appropriate rates in a water system. Next slide. So just to give an update about where we are with LIHWAP process, we've made significant progress in partnerships with states, territories, and tribal governments. Based on the legislative instructions, OCS has developed a formula for allocations to states, territories, and tribes. Grantees have received terms and conditions modeled largely on LIHEAP assurances and procedures, and have received awards with initial conditions that allow them to spend up to 15% for administrative and startup costs. Full grantee plans are now being reviewed. Some grantees have already received feedback, and over the next few weeks, we expect to see a large volume of plans accepted so that grantees will begin making payments on behalf of households. And we're all very excited that this stage of the effort is coming because it means real benefits start to be felt in communities. So next slide. With that in mind, OCS has continued to consult with the field and assess options to meet the needs that can't be addressed with LIHWAP funds. As we shared, our legislative instructions, while brief, clearly specified that payments for household water benefits must be made on behalf of households to water utilities. And this is in and of itself a complex undertaking, given the thousands of water systems in states and communities across the country, but it does not address the full range of needs that households may experience related to water. Most specifically, we've heard from a number of experts and from experienced practitioners that a contributing factor to high household water bills in some households can be leaking water fixtures such as sinks, toilets, and pipes. And in some cases, this may affect the ability to reconnect water services. And given the specific limitations in LIHWAP, OCS has been working to identify other options, one of which is the Community Services Block Grant, which has some potential resources that may be able to help. And we think this also provides, as we'll share, an opportunity for other types of coordination. So next slide. Many of you are very familiar with CSBG, but for those of you who are not, CSBG is a highly flexible resource to address the causes and conditions of poverty based on locally identified needs. The annual appropriation in FY21 was $740 million, but the network is also currently administering a $1 billion supplemental appropriation received as part of the Coronavirus Assistance and Relief Act, or CARES Act. CSBG funds go to a national network of over 1,000 eligible entities, generally known as community action agencies, which means we have a nationwide community presence. And these are a natural resource for supporting these water assistance efforts. Many have in fact been selected by states to be the local administering agencies for LIHWAP, and many are also the local administering agencies for LIHEAP, or energy assistance, and have been experienced in addressing weatherization-related household repairs through LIHEAP or through the Department of Energy's Weatherization Assistance Program. So we believe that regardless of whether the Community Action Agency is actually directly administering LIHWAP, it is a natural partner for these efforts. So next slide. To help encourage these partnerships, OCS issued a new joint program guidance dated August 9th, discussing allowable uses of CSBG for small-scale household maintenance issues, such as fixing leaking pipes, leaking toilets or other fixtures, and also discussing other opportunities for collaboration. These two documents are similar, but are tailored to the different grantee audiences. And if you've not already read them, the link is provided in this slide, and I believe we can share it in the chat. We encourage you to review these, and if you've not already done so, initiate discussions about collaboration and support between LIHWAP, CSBG, and then other public and private resources. So to share more about this, I'd like to hand things over now to my colleague, Cherise Johnson. She is the Director of the Division of Community Assistance, and I will hand off to Cherise. Thank you.
Hi, everyone. I just got a text message from Cherise. She has lost power. She's experiencing a storm where she lives. So we are going to actually move on for a second to one of our external guest speakers today, Wayne Metro Community Action Agency, to talk about some of the work that they've been doing. And then when Cherise is able to join us again, either by phone or by video, we'll turn things back over to her. So with that, I'm going to turn it over to Louis and Mia to get us started, really going over some of the wonderful work that they've done so far.
All right. Well, thanks, Dr. Howard. And I just want to, thank you and the entire, OCS team for the invite to be here today and talk about our work in this space. And also just thank you again for the recognition of all of our work in this area. So I have Mia Harnos with me today. Mia Harnos is our Chief Innovation Officer at Wayne Metro. Mia's main level of responsibility is to integrate services and to wrap around as many services to a Wayne Metro client as possible. And I think I forgot to tell you who I am. I'm Louis Pisker. I am the CEO at Wayne Metro. I'm just excited and ready to dive in because Wayne Metro, we have been involved in an effort to make water affordable and to provide safe, clean drinking water to residents in Wayne County, Michigan since early 2015. Mia laid some groundwork for the agency in this area, and I'm gonna turn it over to her. Our service area as the Community Action Agency for Wayne County there's 43 communities in Wayne County, with the county seat being the city of Detroit, and we also are the Community Action Agency for the city of Detroit as well. So with that, I'm going to turn it over to Mia to get us started, and Mia and I are going to tag team our slides together. Thanks, Mia.
Thanks, Louis. Hello, Dr. Howard. Hello, peers and colleagues from across the country. Greetings from the D, from Detroit, Michigan. I want to start really first by trying to maybe set the stage a bit for you all. So next slide, please. When we arrived to this work, the city of Detroit was coming out of a bankruptcy. They had been through a de-designation as a community action agency, a public one. And so in 2012, we stepped up, we helped kind of get that back up and running. We became interim. And then after a few years, we did apply and secure a permanent designation. That whole process in itself is a day-long webinar, but I want to start by saying we were new to the city. We had to earn our place. And so what we got to work was showing what's possible when you solve issues through public-private partnerships. So the big water crisis both in Detroit and Flint, were right there in our faces during this time. Lots of, just a lot of work going into creating a new water authority called the Great Lakes Water Authority that separated the city of Detroit municipality from, and created an authority with a board that the region could be represented. So once that took place, there was all these grand bargains that happened. And as part of the grand bargain, there was a negotiation at a 0.5% of revenues to be designated for an assistance program. So while all this was going on with all the water crises, we had an opportunity to leverage then what we were building in the city using private dollars through the LIHWAP program. And I think that first allocation, Lewis, helped me. I think it was like 4.5, 5 million?
Yeah, it was, Mia.
Okay, so the goal, Detroit had huge arrearages. Flint, folks know, the story in the city of Flint with the drinking water. So the goal for us was to utilize this money and pay down arrearages and really get that up and running. But what happened was we felt like we were failing miserably because it took one person 12 weeks and 6 bus rides to get one water bill paid because of our bureaucracy internally. So we had to get to work and we started mapping some client journeys. And it is really what led us to figure out how to really do this well, how to put the person at the center of all of it, and then blend and braid the funding around the family. And so that's when our human centered design work started going. Our Kresge Foundation, Detroit Next Gen, shout out Dr. Hatter Joel, they really focused us in on this true approach to centering equity and transforming our collective impact work by focusing on people. So I'm going to turn it back over to Lewis. Lewis, do you have anything to kind of pick up on that?
No, I think the thing that we kind of came out of the work is when the program was launched, we really got slammed. I mean, we got slammed. Our call center, we couldn't handle the call volume load. And so just want to all of the service providers out there that are going to be receiving this, water is a major issue, and it's a major issue across the country in terms of affordability. And we're going to try to take you through the steps of how we leveraged our community services block grant and other funds to make sure that water just wasn't an add-on program to what we did, but it became a program within the wraparound toolbox that we use to service families and integrate services and provide the most services that we can to an individual or a family. So let's go to the next slide. So just a high level, and then I'll kick it back over to Mia. The RAP program, the Water Residential Assistance Program, this is the program that Mia talked about that was private funds. It's, like I said, ratepayers pay 1.05% of all revenues from ratepayers go into this fund. And so the RAP program provides for arrearage assistance. It is a payment plan program. It's a bill credit program. And it also includes some minor plumbing repairs. Importantly, it includes home conservation and education. And it also provides some resource and program. We do some resource and program navigation with it in terms of wrapping around services. The maximum arrearage you can get in 1 year, help me out, Mia, is $1,000 with an additional $1,000 in conservation or minor plumbing repair. So the maximum assistance you can get through this program is $2,000, but you can stay on the program for 2 years. And we have advocated that if you're a senior, or if you have a disability, we call it RAP Infinity, where you can sort of stay on forever to make your water affordable in Wayne County. Did you want to add anything to that, Mia, on just a high level overview of the program?
Yeah, I do, because what we did was we spent time co-designing this program. It was like 6 hours. I think it was like for 6 months a week. we, you know, we made the decision to model, and this is important, after the Michigan Energy Assistance Program. That is a program funded through LIHEAP. And so, you know, it looked a lot like that when we launched it. It was 150% of poverty. Now it's 200%. We did this so that existing staff and our existing systems could be leveraged. We knew we did not want to create a separate program, but one that could be easily leveraged. It was not easy, but it was necessary. So we modeled this very flexible funding after Michigan Energy Assistance, and we learned a lot. So it was, you know, like Lewis said, the water providers liked it because they got $350 upon enrollment. So we worked through what is going to get water providers to opt in. You got to be thinking about that. How much capacity, you know, can you help add to, you know, what the water providers are going to have to do to receive these funds. This is a new program. So one thing I will say is that once RAP was up and running and, you know, we were kind of cranking on it, we were doing like 500 enrollments in RAP a week, this Water Residential Assistance Program. That's how popular water was. That's nothing compared to what we're doing now with the rent program. But what I'm saying is this program really got us ready and battle tested for what we are experiencing now with the COVID response. Thanks, Lewis. Next. Do you want me to kind of kick this one off?
Yeah, keep going.
So CSBG has continues to allow and enable us to build our infrastructure, that integrative and generative infrastructure that is growing and evolving as our organization builds and creates solutions. So we use CSBG a lot of times to fund and seed things. And then we go after the bigger dollars because we've laid the groundwork. So for instance, we created this call center. It didn't exist before. We started with 12. Today we have 50 information and referral specialists. They're manning our phones. They're receiving texts. They're doing web chats and appointments. We built out a universal application. We did it using free tools like Google Forms and Sheets first, because we were dealing with just tens of thousands of people asking for multiple services during this, you know, from funeral expenses to mortgage assistance, you know, to water. Because we were dealing with such large numbers, we broke Google. I can say that we officially, Wayne Metro Community Action Agency on the Bible, we broke Google twice. And so we had to switch over to a paid solution, but we figured it out. And through the universal application, we found out residents were asking for 2.5 services on average, and food was the top, and water and energy were the same, pretty much the same amount. So were we doing the right thing by layering in water and energy? Yes, absolutely. And so, you know, over this time, the systems now that we are devising are no longer, can we blend them? We are blending them. And now we are like automating the way that we are blending them. So maybe, you know, maybe this week you're just getting something from us that says, hey, we're working hard over here. Thanks for your patience. We know, you've been waiting for a while. We're working really hard. Or it might say, hey, we need your documents. So your landlord, is going to get paid and your water doesn't get shut off. We have to, we have risen to this because we have to. I just want to just make that clear. We are doing this because we have gotten to the point where we're smart enough, our systems are smart enough that we can beat the eviction officer to the door and have a mover ready to exit folks from their homes because their water is not on until the water can be restored and they don't have to lose their worldly belongings. I can send 8,000 texts a day. ask, and we get, lots of responses back. So that's the level of service we're providing. Louis, why don't you talk about the cross training of staff and then just the lab and the growth engine?
Yeah, I mean, with the cross training of staff, I think with LIHWAP coming, I think you have to integrate in order to be successful. This is just at Wayne Metro talking. What we did to be successful, I think if we would have cornered or put our water program in a box and that became a separate department, it would have just been another internal silo at the agency. And we just didn't want to do that. We wanted to make sure that water was an integrated tool to all of our other basic needs services that we were offering. So it didn't matter if you were being paid by CSBG or being paid out of LIHEAP. All of those staff got cross-trained into multiple basic needs services. And so they could take that universal application and we didn't have to bounce a client around. That one direct service specialist could provide 2, 3, or 4 services at one given point in time at one single entry point going into the organization. And we used CSBG to build that internal infrastructure. So as additional programs were coming into the agency, and as additional programs continue to come into the agency with COVID, we have this infrastructure built. The growth engine that Mia is talking about is we have leveraged a lot of this infrastructure in order to take on much bigger issues within the city of Detroit, such as the coronavirus emergency rental assistance program and other high volume needs that city of Detroit residents have. And without this built-in infrastructure, we just wouldn't be able to handle the volumes that we see in the city of Detroit, on a daily basis. So we're always trying to learn and grow, serve better. So Mia within her shop has an innovation lab, and the innovation lab is made up of some really big thinkers at the agency in terms of always doing continuous quality improvement. How can we do this better? And then what other funding sources can we go after to not only support the infrastructure, but grow the funding that we currently have? So within water right now, we have our RAP program. We have some CSBG emergency services that we dedicate to water. We have some philanthropic money that came out of this that is dedicated to water. We have Sarah that is dedicated to water. So we now have, instead of just one funding stream for water, I think we're up to about 5 funding streams for water that we can all handle without multiple applications, but with one universal application. So I can't stress enough of building this infrastructure to handle these programs so people are not bounced around within your organization. We just don't believe that is the best way to serve people. So that's just one big way that we have used CSBG to leverage, other program services that the agency offers. So let's go to the next slide. So blending and braiding LIHEAP. This is LIHEAP in the state of Michigan is MEEP. Again, I didn't mention MEEP, but this is an additional program that we're using to leverage. Mia, you want to take this?
Yes. Let me just find my screen. So in terms of blending and braiding LIHEAP, like I said, we mirrored and aligned the Michigan Energy Assistance Program, which was 150% of poverty. It is includes payment plans, includes one-time assistance. The other things that Michigan uses LIHEAP for, of course, is our home heating credit. And there is set aside for weatherization as well. So, we do leverage all of those dollars and combine those dollars with Department of Energy weatherization, to really create a robust energy assistance program. And Michigan is actually number 2 in terms of funding for weatherization. So we have a kind of a big weatherization allocation that we can kind of leverage, again, building this infrastructure. So we can help people with bill payment. we can get them on, payment plans. We can work on bill forgiveness. We can protect, we've got this whole winter protection, program that we're able to work with, our energy provider. And again, all of those resource navigation, in the MEEP grant, and I want to give a shout out to our friends at the state of Michigan because they rev up really quickly. And, they keep pace with us, and they are just very, very great partners in this work. And so, having them by and near us and co-designing these things together just makes it so much easier. So get with those organizations at the state level that can really work with you on this because that they are instrumental and very much needed. So just kind of wanted to show that here, again, with water and with energy, there are just so many natural linkages. When we first got into this work, there was a magic like 25,000 people. And this was, I think, just Detroit. But they said there was 25,000 people that were behind or at risk of water shut off. They were behind or at risk of their energy shut off, and they were behind or at risk of property tax foreclosure. I can tell you that we are have been at this for years. And we are making just huge progress. Next slide, Louis, do you have anything else?
No, that's good, Mia. Let me hit on the essential services, because I think this is really important too when it comes to just the large water issue in general. What we found prior to the pandemic and during the pandemic when it comes to water services is, making sure that we can pay down a person's bill so they can have water during the pandemic for hygienic purposes. That's extremely important. But what we found with the housing stock, particularly in the city of Detroit, and all of you out there that are maybe you serve communities in which the housing stock is old, we found that it just wasn't enough, because we had a significant amount of homes that whether the water was off or on, it didn't matter, because the plumbing was so bad that there were just leaks everywhere. And so we really advocated to the state of Michigan, and we used not only our initial CARES allocation, but continued to advocate to the state of Michigan to get some additional coronavirus funds from the Department of Treasury to do minor and major plumbing repairs. We had homes in the city of Detroit where we had 6 inches to a foot of raw sewage in the basement, because the sanitary line from the home to the street outside was totally collapsed. So it didn't really matter if we paid off that person's water bill, they still didn't have access to safe drinking water. And so we really advocated, like I said, and we thought we were going to get $5 million. We got $6 million to do minor and major plumbing repairs. We had 90 days to do it. And because of the built-in infrastructure that we had at the beginning of the presentation, one of the things I'm most proud of during this pandemic in terms of what Team Wayne Metro did is we repaired minor and major inside the house and outside of the house. We did 600 homes in 90 days or less, and we spent the entire $6 million. And I think we really saved a lot of people and their families during the pandemic doing major and minor plumbing repair. So I think in this program, and when you wrap around water services, there has to be a minor and major home repair plumbing program, I believe, for it to be ultimately successful. And it's part of a bigger Healthy Homes initiative than just water. We took a lot of our CARES dollars and did lump sum payments to restore water. Again, we wanted to promote health and safety. And we also used dollars, as Mia stated earlier, to temporarily relocate families into safe housing, just because the house, in the current condition of their plumbing, the house was inhabitable. I mean, it was really sad. And it was really eye-opening for a lot of the staff as to some of the conditions that our most vulnerable people live in. And I believe that these essential services and the plumbing repair component is essential to our long-term health within these low-income communities. So I know I'm getting on my soapbox here, but I think it's a big part of it. I don't think you can have one without the other, but we are grateful for LIHWAP. I think it's a piece of the puzzle. We just have to, as a network, keep pushing harder for minor and major home plumbing repair. Okay, Mia, I'm going to turn it back over to you.
I like that. I actually like that as one of my soapboxes, or that's one of your soapboxes I like. So you could stay on that one. So in just to kind of close us out, and there's LIHWAP and LIHEAP, and the goal, the ultimate goal would be if we could, LIHWAP is an emergency allocation right now, right? If we do this right, if we do it well, then that means we can come back and ask for more. That's really our mantra here at Wayne Metro. You have to do it well, and you have to be a good partner, and you have to go the extra mile, because that's when you're going to be asked back to the table, right? So last thing I'll say is all of these other programs, again, do not try to create something new. Blend it, braid it, and use it as a driver, to grow your organization and deepen your roots into the community. One thing the question I think that's going to come up is, what would you do differently? And that response is, the consumers need to be heard and highly engaged in the design. Do not launch anything until that. Don't start there. Without those voices, advocates, and social justice organizations, you're dead in the water. We all want the same thing. We have to help those in our communities understand what we're trying to accomplish and find common ground. So go there and invest in those community relationships, like your life depends on it, because it really actually does. So that is my last comment, Louis. And then we can close, I think, our part out.
Yeah, I think we have 2 more quick slides. Next slide, please. I think we talked about this, and this was the service integration. Again, Mia sort of hit on this. This was just, when we get somebody in for water, we're looking at food, shelter, rent, mortgage, property tax, and anything else that we can blend, braid through the infrastructure that we talked about up front. And I want to make sure we respect the time of the other presenters. I think our next slide, if we have time to play it, it's I think a 2-minute video on one of our clients of the year that received water assistance, Denzel, and he can tell you a little bit about his story. If you guys want to play it, I think please do.
There was a really major leak in my house. Pipes burst during the winter time. My basement floor became an ice rink, okay? So in this time, I didn't know how to fix it. I didn't know what I was gonna do. Before I knew it, the bill was over $2,400. So I was almost in shut-off range, but I found out about the LIHWAP program when I was in that long line at the Water and Sewers Department. Once I applied for that, everything turned. They really made it easy to be able to understand knowledge on how to conserve energy when it comes to dealing with water, when it comes to knowing how to conserve water, maintain, keeping a cheaper bill altogether. Partnering with the Wayne Metro Community Action Agency through the LIHWAP program, Wayne Metro in the education classes allowed me to get a better understanding of these things prior to the LIHWAP program coming out to my house. So as we speak, I'm working on some music. I also write music in orchestral scores. So my goal for the future is to get a chance to publish the music and get it performed, as well as I perform vocally and instrumentally, because I'm also a trombone player. I am most definitely empowered to be a smart homeowner. The LIHWAP program has not only taught me, but has given me the power to know that as a homeowner, I too can make a difference in the city of Detroit and to help others to understand that there is help out here.
Thanks for playing that. Yeah, he was a really, really great guy, and he's doing really, really well. And so I appreciate the time that you gave us today. Hopefully we added some value to the presentation. And I'm going to turn it back over, I believe, to Miranda.
Actually, I'm going to jump in. Thank you so much, Louis. Mia, amazing presentation. Hopefully you all now understand why they were our go-to presenters for the session today. Before we turn to our Q&A portion, we do want to go back to one of our other presenters, Cherise Johnson. You may have heard she was having some power issues. I believe she's on the line. So Cherise, if you could say hello, make sure we have your audio.
Hello, everyone.
Great. And Frank, could you please move the slide deck back to around slide number 14, I believe? Does this look like the right one for you, Cherise?
I think we're at the right place. I want to say good afternoon to everyone, and I apologize that my power went out, so I couldn't actually be able to give my presentation during my turn. But I also want to say that Team Wayne Metro, you did an outstanding job. I was able to listen to your presentation, and in a very interesting way, it aligns exactly with the comments that I'm going to share today. So I just want to say thank you to you all so much for sharing your experiences and giving us recommendations in regards to this work. You made my job so easy that it's going to seem repetitious, but first of all, I want to say that I'm Cherise Johnson again, the Division Director for the Division of Community Assistance. I am honored to be a part of this discussion today and really talk about a little bit more about some of the things that Louis and Team Metro discussed in regards to flexibilities within CSBG and opportunities that CSBG and the eligible entities have to support families. In my mind, from the beginning of CSBG, the goal has been to mobilize partnerships and shared goals to support families impacted by poverty. Today, you all have heard about another opportunity through LIHWAP to provide critical support to low-income households and to reduce some of the stress families may experience when they're forced to choose between paying bills and paying for water and just being able to meet their basic needs. I do want to just to reiterate some of the things you just heard around how CSBG is extremely important in leveraging and braiding funds. The CSBG network is extremely familiar with leveraging or pooling resources to gain maximum results to serve more individuals and families and to provide wraparound services to move individuals and families beyond their current conditions. In addition, the CSBG network, we braid funds by combining multiple funding streams toward one purpose while separately tracking and reporting on each source of funding. And that is one of the unique pieces about CSBG, is that you're really able to think about how do we work using strategic practices to make sure that we meet the unique needs in the community. As we move to the next slide, and I think you've heard reference before, the Office of Community Services is encouraging CSBG grantees to look for ways to support the entire family. During the session yesterday, one of the presenters commented, and he said when individuals and families are not able to meet necessities like housing, food, etc., there's a high probability that paying water bills may be a challenge as well. And if we keep that in our minds, we can see where the link between CSBG and LIHWAP and LIHEAP are opportunities to really wrap around the entire family to help them to meet their needs. I'm sure you will agree, and even after hearing the conversation from Team Metro, I'm sure you will agree there are many reasons why households have high water bills. They have plumbing issues, they have leaks, and sometimes CSBG can step in to support small household plumbing repairs and to coordinate a range of other services and supports for households receiving assistance through the Emergency Low-Income Water Assistance Program, or LIHWAP. Grants administered, which is also another grant administered by the Office of Community Services. CSBG grantees and eligible entities are also encouraged to consider opportunities to coordinate intake and when possible to link LIHWAP assistance to other household assistance programs provided by CAAs to support small scale repairs or replacement of leaking pipes, just different things to make sure that we're helping families to be able to manage their needs, help them with small repairs, but at the same time, helping them to control their water bills. We're able to think about updating fixtures like faucets, showers, or toilet fixtures with more efficient replacements, which can definitely help to reduce water bills. We can purchase water filters to remove contaminants from drinking water to make sure that we address the safety issues that exist within a family or within a household. So CSBG has a lot of opportunities really to wrap around and support families as they deal with meeting their basic needs. I think it's been said, but I'm sure it's important to note again that the CSBG resources, however, cannot be used for large-scale construction. However, CSBG and CSBG eligible entities are known for finding innovative ways to access public and private partnerships that may be an option. And I think we heard about one earlier today. And then in the next slide, we just want to talk about the fact that the eligible entities and eligible entities through CSBG can use their community needs assessment to provide an opportunity to rethink needs and addressing the needs of the families and households in your community. The community needs assessment is a powerful tool to make sure that we're prioritizing and recognizing how we can support those in need the most. We should be considering ways to use a holistic and system integration framework through strong communication within the community with partners, sharing information. I think I heard about coordinated intake opportunities, eligibility opportunities like a one-stop shop through a resource center model in order to make sure families have an easy way to access resources and wrap around services. We also have within CSBG and many of the eligible entities provide financial management assistance, which may include debt counseling, financial planning, and asset building efforts, all to help families move beyond their current conditions and hopefully to help them to reach self-sufficiency. We also can think about ways that we can work within the community to think about how do we coordinate our resources best. And that means reaching out to TANF agencies and to other community agencies through referrals and linkages to help families to be able to access additional resources. Employment and training and transportation and rental assistance, nutrition and other referral sources also can be a great asset that CSBG entities really have the opportunity to establish in the community to make sure that we're addressing the mental health and wellness of families, to make sure that we're addressing their basic needs. It just seems like there's so many ways that CSBG and CSBG entities can really work together in order to make sure that we wrap around families, we use our resources wisely in the community, we communicate and collaborate on ways to make sure that families have what they need in order to be healthy, to be safe, and in this situation to have access to water. So I want to thank you all again for being patient with me because I wasn't able to be on the call earlier. This was a great session, and I'm going to now turn it over to Lauren Christopher.
All right, thank you so much, Sharice. I'm glad you were able to join in and share those slides with us. So you've heard now from Sharice, as well as from Mia and Lewis about this braiding concept and really trying to be thinking about all these different federal sources and all their different rules and how they can be coordinated to braid one holistic plan for a particular household. So without further ado, let's make sure we move into our Q&A portion of this session. Just a reminder that at the bottom center of your screen, to the left of the chat box button, there's a Q&A button. And if you haven't been following it, there have been questions posted and answered already in that Q&A box. So please continue to add your questions to that box. Some of those questions we'll answer live during the Q&A part, and some we'll just put in written answers for you all to follow along. Also, if you do look at the chat box right now, you can see we have posted the link for the evaluation in case some of you have to leave a little early. It's a very quick 6-question survey, so we do really appreciate your feedback and just taking a minute or less to answer that. So now, finally, I'd like to turn to our partner at HHS, Ms. Miranda Lynch-Smith. Miranda, take us away.
Thank you. Thank you so much, Lauren. And what an amazing set of presentations so far. It's my pleasure to be able to join you today and moderate the discussion. I first wanted to tell you a little bit about the office I lead before jumping into questions for our panel. Next slide, please. HSP covers the human services side of HHS and works to promote the economic and social well-being of America's most vulnerable populations. HSP meaning Human Services Policy within the Office of the Assistant Secretary for Planning and Evaluation. We do love our acronyms. We work in HHS and across federal, state, and local sectors to increase the effectiveness of human services programs and policies and reduce fragmentation of the safety net, as well as to improve well-being outcomes and equity for children, families, and communities, particularly those with low incomes. Next slide, please. We like to describe ourselves as a think tank and policy advisor to the Secretary of HHS, but we really do work closely with the Administration for Children and Families across the department and across government. We conduct policy research, analysis, evaluation, and coordination on various issues across the department, including but not limited to poverty and measurement, vulnerable populations, early childhood education and child welfare, family strengthening, economic support for families, and youth development. Our office serves as a liaison with other agencies on broad economic matters, and we are the department's lead on poverty research and analysis. This includes funding a national poverty and economic mobility research center. We have an amazing analytical tool that simulates and helps us to model how changes in policy related to taxes, benefits, and health can impact people and programs. And we leverage the census official poverty measure to publish the poverty guidelines each year that many of you use for your programs. We do our work with a small team of diverse experts from economists to social workers to community psychologists. And we thrive on being able to make connections across programs, drawing out insights from stakeholder partners, those with lived experience, and the data from one part of human services that can be applied and acted on in another. Next slide, please. We see as one of our key roles is collaboration and coordination in service of better outcomes across safety net programs. That work takes many forms, and I'll only mention a few to give you a flavor here. We lead formal work groups like the Interagency Council on Economic Mobility. ASBE coordinates this Interagency Council. It coordinates across employment and work support programs to address federal barriers to economic mobility that no one agency can solve. So the council connects several departments. Of course, HHS, Department of Labor, Education, Agriculture, Treasury, Housing and Urban Development, SSA, and key White House offices. We have some big ideas for our work. Coordination and implementation of the American Rescue Plan funding, operationalizing ways to reduce silos across programs, easing administrative burdens across programs, including creating more seamless and multi-pathway eligibility. So good job, Wayne Metro, for doing this, and integrating and linking data. I'm going to pause for a second. Dr. Howard, can you hear me okay? I wasn't sure if you were trying to communicate. Your audio is not on.
Hi, this is Pascal. I know I can hear your audio, but we have a couple of notes that a few people can't. So we will keep looking into that.
Okay, would you like me to just continue or pause?
I think we will keep. You could continue, and we will ask. We will keep trying to test it and see if there's what we can do.
Yes. Okay, no problem. I think I was just wrapping up and talking about the Interagency Council on Economic Mobility. And really the ultimate goal is to work through the fragmentation and complexity of federal programs and make sure that that we're eliminating as many federal barriers as we can, so that we're able to deliver critical support to people when they need it. We represent, ASME represents the department on cross-governmental priorities, such as unstable housing and homelessness. We lead coordination in the department on families and youth with unstable housing, including working with the U.S. Interagency Council on Homelessness. We coordinate across the department on cross-cutting topics. For example, we are helping to operationalize how the department conducts equity assessments in the development of our new policy proposals. And we have been actively working to scan the ways in which local governments have been doing this for some time, so we can learn from those efforts and apply it in the work that we're doing. Another emerging area is with regard to the role that human services agencies can play in advancing environmental justice. We often leverage the coordination work by conducting research on these key topics and publishing briefs and tools that cut across program services to identify ways in which government can work better. For example, we released a handbook that serves as a resource for human services providers to implement social capital building practices to improve participant outcomes. And we also have a series of briefs on the lessons learned in tailoring virtual human services approaches in the midst of COVID, and help folks think about the variety of ways in which virtual services can work better for program participants depending on their context. So since collaboration and coordination across programs is such a key part of what ASBE does, and we are committed to actionable ways to supporting that across governments and community partners, I was particularly delighted to be a part of this session. And I will move us to posing the first few questions to our panelists. And after I pose some of those questions, we'll be able to turn to some that are in the Q&A chat box. So first, I'm going to start with Seth and Charisse. So the panel mentioned that many community action agencies are the local administrating agencies for the LIHEAP program and are also anticipated to be the LIHWAP administrating agencies. What recommendations do you have for CAAs that are not administering both programs? Will these agencies still have a role, and how should those CAAs be involved?
Sure, thank you. I'll start and then Charisse can add as needed. We would just emphasize that community action agencies are intended, part of the whole mission of community action agency is to be an integrator, a linkage resource, and an advocate for low-income communities, regardless of whether they control the funds directly or are working in partnership with other agencies. And so we would encourage those conversations to begin regardless of whether the community action agency is directly administering the LIHEAP or LIHWAP grants, or if they are going to be working in partnership with other agencies. Clearly, if the agency manages LIHWAP, and then there's opportunities to really build that integrated intake system that like Louis talked about. But regardless of that, it is always still possible to do that, and it's sort of our responsibility in terms of looking at the comprehensive needs of households and bringing those service packages together. And these CARES Act resources can be a valuable contributor. So that would be our first suggestion in that area. And Charisse, I don't know if you want to add anything on that. But for now, I think that would be our suggestion in that realm.
Okay, thank you. Another question for you guys. I want to ask, how will the income eligibility rules across programs influence the approach taken on the ground to leveraging or braiding these different resources with LIHWAP?
Sure. So, one of the things that Charisse shared in that braiding slide and that we're hearing from others is each of the programs that contribute to an effort need to come with their own rules and processes and restrictions. And that can be part of the challenge, because we do need to, we need to maintain those. That's what the concept of braiding funding is. Sometimes you will have programs that have slightly different eligibility criteria, and that is a challenge. And it would be also interesting to hear from Louis and Mia's perspective, how that has how they've addressed some of those issues. But just to kind of share that, for example, CSBG currently has a, through the end of this fiscal year, will be at a 200% level of poverty level. It will later, we expect to revert to 125%, which is the kind of standing statutory level in terms of the regular CSBG appropriation. We know that presents real challenges in terms of administration and processing. But we also continue to explore creative solutions. I will say that with LIHWAP, the funding can be used. We are really encouraging things like what we call categorical eligibility, meaning that you can, if you are receiving LIHEAP services or potentially a range of other services that are specified, such as TANF, and have gone through eligibility determination, you can present, we will have you can categorically determine that household to be eligible based on whatever the state's policies that have been put in place for the grant. And we strongly encourage exploration of those options to make it as seamless as possible from the household's perspective. We recognize how challenging it is to administer a program with multiple rules that apply, but to the extent that we can pull it off, the goal is for the household to have a more seamless experience and not have to provide multiple rounds of documentation and materials to apply for services.
Seth, this is Mia. Can I add to that? So that categorical eligibility, I'm glad you guys brought that up, because that is like another critical point, is that the less we have to do with proving someone's eligible, the more time we have for the real human-centered work. So, we did a categorical effort. I mean, we're still doing that, but at the state of Michigan, if you were a state emergency relief recipient, we were able to get you enrolled, let's say, in CARES. If you were a Head Start family, because you're 125% of poverty, think LIHWAP is 150. So you could go to all of those families that exist in your programs today and ask them, if these are things that they need. But if they have that one pass, that pass that gets them in, and that they're already enrolled in another program, why wouldn't you? Just bring them along and add that reinforcement to the work.
Thank you, Mia. All right, so I have a question that is for you and Louis. So what, if anything, would Wayne County do differently now in leveraging other resources for a water program based on the lessons learned from its prior experience?
Mia, you want me to take it and
That sounds like a Lewis question.
Well, then you can disagree with me and tell me what you really think. So I think one of the lessons learned for me is that we underestimated, well, we knew that there was going to be high demand for the program, but until you're in it, you don't realize the level of need and the velocity at which it is coming at you. And we were building that infrastructure and trying to handle the velocity and the volume of people calling us to make sure that they weren't going to get shut off and get a shut off notice or get shut off by the city of Detroit. And you know, the one thing when we started out of the gate is we looked at the RAP program at a single focus, like how do we handle this problem? You know, how do we service all of these people that are just desperate to make sure that their water isn't going to get turned off? And I think after we settled things down, got comfortable with the volume and built water into our infrastructure, we were able to not look at it as a singular program, but as another program tool in our toolbox to create some relief for families and households. So it wasn't just water alone, but it was water and a bunch of other basic needs programs. So I wish probably maybe I would have done a little bit maybe better planning at the front end, but until you experience that type of volume and velocity, I think you just kind of have to experience it and sort of get smacked around a little bit and then get a hold of yourself and get your agency back on track. I think it was just maybe the prep and also forcing us that we have to rely on, we cannot be a siloed agency. Like if you're doing any type of basic needs work, you're doing water and we're going to train you and we're going to cross train you. So we weren't going to build like another like water department. You know, if you were doing utilities, you know, if you were doing some housing assistance, you know, if you were doing like some weatherization intakes, you're doing a water intake. And so, you know, clients could use that universal application and apply for 2, 3, or 4 things, and they would have one direct contact through our Connect Center. So I think the planning up on top would have been, could have been a little bit better for us. I also think that the follow-up and how you engage with clients when they're waiting is a big deal. I don't know what the volumes are going to look like here when this program launches, but you have to, people were like mad at us because they were waiting maybe 2 weeks for an appointment. And that's when Mia talked about it very quickly about texting. So we developed a system that if you were waiting, we were texting you at various intervals to let you know that we haven't forgotten about you, that it was just a soft check-in. And as you were waiting, these were some other things that you could be eligible for. And then we also had clients that maybe didn't understand what their water bill looked like, if you can believe that, or we needed, if they were a renter, we needed the lease that showed that water was part of your lease. It was an eligibility criteria. And so we were putting, like, when we texted, we were texting examples of what the documents look like, so that appointment would be very efficient. So one appointment wasn't 3 appointments to get somebody eligible. It was 1 appointment. And so it was just the forward thinking regarding putting people first and that client service that I think really launched us and made us successful in some of these other high volume programs that we were receiving due to COVID. I don't know, I'm trying not to be long-winded, but I think that's my answer.
All right, Mia, did you want to add to that?
Lewis, trying to not be long-winded. The one thing I'll say is don't be afraid to utilize your staff in a different way, but make sure that they're bought in to this whole new way of operating. So, you know, if I think if you were to do some swaths of you know, styles in most of our organization, there is a value to being highly compliant, right? Because that That is important. We have to have highly compliant people, though, who are also big thinkers and very creative and do like to take and create new things. And so, you know, I mean, folks are either, you know, ready for this program or they're not, but don't be afraid, I would say, to look at, you know, other high performers from other parts of your organizations who want to launch something really big and you know, who to their, you know, credit would think this is like oxygen to them. Try, you know, don't feel like you have to put the same people doing the same jobs if you want a different outcome. But, you know, look at the organization, look at where you're going to find innovation, creativity, pockets of, you know, folks who are really working hard to make things better and, you know, give them a shot to, you know, to share ideas and be a part of this important work. This is the first thing of its kind in the country. And I think people are going to get really excited about it.
So I'm going to ask another question to Mia and Louis that kind of combines a couple of questions that I see from the chat. And I think it really is a question that's about tracking and measurement. So if you could talk about what you might have put in place in terms of measuring.
Yeah, Mia, let me start and you can back me up. Is that okay?
Yeah.
We have at any given point in time, so and I did see that. So from a measurement perspective, we have about 4,000 people that we manage, 4,000 clients that we manage that are in a water assistance program. So they can stay in the program for 2 years. Unless they're disabled or they're a senior, and then they can stay in the program forever. And that program is a combination of bill credits and conservation measures. So we have about a 95, 96% success rate in clients that adhere to the bill credit. So the client has to make a payment, they have to be current, and they get a $25 a month bill credit. And if they stay consistent, they get lump sum credits to their bill that takes down those arrearages. So within a 2-year period, we can clear an arrearage and we can make sure that that person is current. And we also provide conservation measures to reduce the consumption of water. So we do have some data that the conservation classes that we have our clients take, along with some of the other like conservation measures, reduces about water consumption from anywhere from 20 to 30% on a bill, which is a game changer, along with that minor plumbing repair. That question came up as like, you know, how do you use CSBG for minor plumbing repair? We really advocated hard to the state of Michigan that our data was telling us that we needed about a maximum. So we don't do those like major improvements, that they're like minor improvements. So we argued we needed $2,500 a household. That's our measurement right now. And that $2,500 a household, we can make sure that there's a working, at a minimum, we can make sure that there's a working sink, a working toilet, a working shower. The hot water tank you can get hot water. So that $2,500, and we can stop a leak. So we wrap the $2,500 in minor home repair with the bill credits, with some other things to holistically get that bill down so we can keep people successful in the program. So I think we have a good track record. I think that, again, there's about 4,000 people enrolled, and that's consistent, and we have a really, really good track record. So I can say that there's 4,000 Detroiters that are current on their water bill at any given point in time because of the combination of these programs.
Yep, I would also add that 90% success rate. So what does that mean? That means that people have at least enrolled and finished potentially their first year of RAP, right? And then they're eligible for more. So we are averaging around a 90% success rate. And we think that that is huge, because when we started, based on how we were serving and how we were set up as an organization to not be human-centered, we were, hey, run to Kinko's, go and take a day off work and, have office time with us, rather than, the way we're handling things now, which is way more quick and efficient and effective and human-centered. But, so we went from a 50% show rate now to a 90% acceptance rate. So that is, to me, resounding success. But at the same time, we're still finding ways to improve every day.
Yeah, we are. The texting and in our we not only do we, let me add to the texting, and we also do robocalling. So we are trying to really stay in touch with our clients as they are waiting or waiting for services if they're on a wait list. If we know we have a senior that's coming through the Connect Center, we'll ask if you have a cell phone and can you accept a text. So we will ask that question when it comes through. If the person can't, they're just ticked off that they're getting more robocalls than they are a combination of texts and robocalls. So we sort of customize. We can customize that. But the client contact is super important, and it really creates engagement with the client and your organization. What is your turnaround time? It depends. I mean, it depends on the volumes that we're servicing. We try to get to everybody within 2 weeks or less. I mean, we see like high volumes. But if it's going to be, but that's where the texting and the robocalling comes in. If it's going to be longer, we're telling you. If it's going to be shorter, we're gonna try to move up your appointment. Also, in our Connect Center, as the calendars open and close, that's like a big jigsaw puzzle. If we can move people up, we will, so they don't have to wait. Everything is human-centered, people first.
I'd also say it depends on the need. So, we had a family that presented as not having water or was going to have their water shut off. So we did an intake with them immediately, right? Because maybe, like, literally, we sent our PATH team, our street outreach, over there to, figure it out. So there's like those kind of issues, or, I got a shut off notice and here's when it's going to be shut off. The other thing we have is really good relationships with the utility providers. And so when possible, if someone's scheduled for a service interruption and they know they're going to see us, we share these lists. And so at least they know that they're going to, be seen within the next couple of weeks. Those service providers will work with us. Gosh, there's just so much we can share with you guys.
Hey, Mia.
Yeah.
For the RAP program, when we have the RAP Infinity, if you're disabled or a senior, I don't want to speak. I don't want to answer incorrectly. Do you recall the definition of what constituted a disability and what age were you considered a senior for RAP? Do you recall that? If
RAP, I was 65.
Okay.
I think. And then, but don't quote me on it, but there's a RAP webpage I put in the chat if you guys want to look through it. But it does, it is, if you have a physical, mental disability, if you receive Social Security disability, SSI or SSDI.
It automatically qualifies you for that RAP Infinity.
That's correct.
Okay.
This is Seth. I'm going to just jump in for a moment, try to answer one additional question, at least in terms of, we had one question that had come in that was asking regarding how, with CSBG, how we reconcile the guidance about using for small scale household repairs with the prohibition on construction or permanent property improvements. And so just to kind of give you, we do know that is sort of where that distinction that Sharice and others made between small scale, what we would consider to be kind of a maintenance type of changes, a leaking pipe, a repair to a fixture in a home. That is not a permanent property improvement. That is a maintenance type of issue. And that is, so we distinguish between that and sort of a major retrofit of the plumbing infrastructure of a household. And so we know there is, that is an area we would encourage you to go ahead to look at and read the guidance, to consult with your state office on this as well, but that to know that from our perspective, those small scale household repairs are more of are in the realm of maintenance and not a construction type of an effort. So I think I will ask if Lauren, if you would like to kind of come back on in terms of beginning, we are near the end of our time. I believe there was, we had just one other question that had to do with OCS is preparing to release some additional guidance, and we're hoping that we will be able to, that we'll also share other resources. So recognizing CSBG can be an important part of this. Part of the reason we had the presentation about other resources is CSBG is also about leveraging. It's about bringing other resources to bear. And so for those larger scale, I think the property improvements, we encourage you to keep looking and working with all the different available resources that are available, both in the COVID response and in other efforts to help address. We recognize that there are needs that our resources can't address, but that is part of the CSBG mission, is to help bring together and leverage a variety of resources. Lauren, I'll hand off to you.